Greetings, YouTube. I thought I'd show off some of the gear I'm currently using because of my medical issue. Now, this is the Franken Shoe that I mentioned in my original video about my ulcer. You'll notice the inside, there's these hexagonal cells, and each one of these cells is individual. So if I wanted to, I could pull one of those things out. I couldn't get it back in, so I'm not going to. But I pull it out, and that would then create a hole between this surface here and then this surface here. So there's those cells are about 3/4 of an inch long, deep. And so they have been removed here under my toe, so that when I'm at the house, I'm wearing this, and there's a space, so my toe has no load on it. It's what they call it. It's an off-loading shoe. Now this is a pair of Chippewa Boots. These are my old boots. These are not the boots my current pair. This is the old pair, and they are steel-toed. And you notice that the sole is attached directly to the leather liner. Okay, directly. Now, this is the medically modified boot that I am wearing. Not at the moment, obviously. So here's the leather, and here's the sole, and they have inserted this spacer, which is about 3/4 of an inch thick, and it's a wedge shape, and it's very specifically shaped. And the reason this is this: when you walk on a boot, it does that. Okay? It's supposed to. Your toes are supposed to rock forward so you can walk properly. That's how we walk. But if I do that with my right foot because of the ulcer, it will cause irritation and will keep my toe from healing. So they put this wedge in here so the boot rocks and there is never a crease here when I walk. And so my toe is kind of pointing upward slightly. You can't really, I mean, I have neuropathy, so I can't feel it, but I don't think you'd even be able to tell a whole lot, even if you could feel your foot. And so my foot rocks here as opposed to bending there. It's a very natural process. Once in a blue moon, like 3 or 4 times maybe a day, if I'm wearing these all like 10 hours at work or so, I might limp. But other than that, it's very difficult to tell that I'm wearing this. If I have to move quickly, it gets a little more difficult, but I just try to not move quickly. I try to schedule my movement so that I move at a normal walking pace, and you never know. I have it in, and I don't think anyone at work knows I wear it, because I haven't mentioned to anyone that I have this particular medical problem at the moment. Now, because of this, it means that my toe has no load on it, or the minimum load, and it will help me heal faster. And at the moment, the toe is doing very well. I did learn that I got a staph infection which caused an abscess which led to the ulcer. So, and staph infections aren't horribly uncommon, particularly in a warm environment in here, because again, these are steel-toed shoes. They don't, even if they're leather, they don't breathe at my toes all that well. And my normal ones are waterproof as well, so they breathe even less. Though leather does breathe better than like plastic, obviously. But this older pair are not waterproof. They're water resistant because I treat them, but they're not waterproof. So with this boot, and I did wear this the first time I had an ulcer. It helped a lot, and I need this because I have to work. I have to wear steel-toe boots at work, and because it could take me months for this to heal completely. It took 14 months the first time, but this one is much less severe. I hopped on it faster. I got medical treatment, and I knew what was going on, so I knew how to handle it and address the issue more quickly. So because of that, and my proactive stance, once I realized something was wrong, it should take less time. So I'm hoping I can get this healed in like 3 to 5 months, maybe. We'll find out. We'll see. I go back to see my doctor Monday to have him take a look at it, but it had noticeably gone down in a 1-week time span, so that's awesome. And he's now been able to remove all the necrotic flesh, so there's no necrotic flesh left. So that's nice. So the toe still looks like something chewed on it, take my word for it, but it's looking far better than it did the first time I looked at it when I realized I had a problem. So this has been a little video here about the medical gear that I'm currently using, this one at home, and this one when I'm out and about. I also have discovered that using my wool socks is better in these, because these don't have my orthopedic insoles, because I can't put them in here. These insoles are permanent, they don't remove, so I can't put my insoles in them. My new boots have that advantage. You can take the insoles that come with the boot out and put a new one in. This doesn't. So with the wool socks, however, I'm getting less motion and less sock slide and things like that, so that's helping as well. So I hope all of you folks are healthy and have funky boots.